Today we are going to look at the paraneoplastic syndrome and their underlying cancers. So, firstly, to ask questions, the first question is, what is the SIADH and what are the associated cancers? So SIDH, as we know, it's nothing but the syndrome of the inappropriate anti-diuretic hormone secretion. And the next question is, what is the hypoglycemia and the syndrome associated? The third question is, correlate with the osteomalacia. So we'll find these answers in this video, and there is also some bonus questions at the end of the video. To start with, we look at the Cushing syndrome. So in case of the Cushing syndrome, the major forms of underlying cancer, it includes the small cell carcinoma, and this is a small cell carcinoma of the lung. Next, it also includes the pancreatic carcinoma. Next, also the neural tumors and the renal carcinoma. So what is the mechanism behind this? The mechanism is that it is ACTH or ACTH like substance. Then we move on to the SIADH, which we already know that it is the syndrome of inappropriate antidiuretic hormone secretion. So here the underlying cancers, it includes the small cell carcinoma of the lung. Then we also have the intracranial neoplasms. Intracranial neoplasm. And beyond this, we look at the mechanisms. So under the mechanisms, there is also the anti-diuretic hormone or the atrial natriuretic hormones. So this is the mechanism behind the SIADH. So then we look at the hypercalcemia. So under hypercalcemia, it can lead to the squamous cell carcinoma, and this is nothing of the lung. Then there is also the breast carcinoma. Hypercalcemia is also associated with the renal carcinoma as well as the adult T cell leukemia or the lymphoma. So what is the mechanism behind this? The mechanism is that it is a parathyroid. It is a parathyroid hormone related protein. So in short, it is known as the PTHRP, that is a parathyroid hormone related protein, and TGF alpha, TNF, as well as the IL-1. Then we look at the hypo, the hypoglycemia. So what is the hypoglycemia? It is related to the ovarian carcinoma as well as the fibrosarcoma. Then after this there is also other mesenchymal sarcomas. There is mesenchymal sarcomas. And what is its mechanism? The mechanism, it involves the insulin or the insulin-like substances. Now we look at the polycythemia. Polycythemia. So polycythemia can lead to the renal carcinoma. It can also lead to the cerebellar, hemangioma, and also it can involve the hepatic. So it leads to the hepatocellular carcinoma. So what is its mechanism? The mechanism is the erythropoietin. Next we look at the osteomalacia. So osteomalacia, here the tumors associated is nothing but the phosphaturic mesenchymal tumor, and the mechanism is the FGF23. Next we move on to the disseminated intravascular coagulation, in short known as the DIC. So the associated tumors here are the acute promyelocytic leukemia as well as the prostatic carcinoma. So what are the mechanism of this? The mechanism, it is the tumor products, it activate the clotting. So now we look at the answers to all our questions. So the first question we asked was the SIDH. So the SIDH, it can cause the small cell carcinoma of the lung. Next, it can also result in the intracranial neoplasm. And what is the mechanism of this SIADH? The mechanism is the anti-diuretic hormone as well as the atrial natriuretic hormone. Next question we asked was, what is the hypoglycemia associated with? So the hypoglycemia, it is associated with the ovarian carcinoma. Next, also the fibrosarcoma. So after this, it also includes the some of the other mesenchymal sarcomas. And after this, what is the mechanism if you ask? The mechanism is nothing but it includes the insulin or the insulin like substances. So after this, we look at the third question. The third question we asked was, what is the osteomalacia? So looking at the osteomalacia, here the tumor it is associated with the phosphaturic. It is nothing but the phosphaturic mesenchymal tumor. Then what is the mechanism of this? The mechanism of this is nothing but the FGF23 is the mechanism of this osteomalacia. So now we will look at some bonus questions which has to be answered in the comments. So the questions are, first question, what is the Cushing syndrome? The second question, so all this it includes, we need to know the carcinomas associated as well as the mechanism. Second one is hypercalcemia. The third question is polycythemia. So these questions can be answered in the comments.